a lot of what I'm about to say. Thank you already, Jenny, for recording. On it. We see we're you kind of down like a well-oiled machine now.
All by myself.
We could all sing the song. Wonderful. So we're going to record this. If people may come and go, which is great. I will keep a good eye on the chat, and also if anybody wants to. If we have this wonderful group, then that's great. We can be having a constant conversation, but just feel free to raise your hand and to go that route. We'll be saving the video, we'll be saving the chat, and then we're going to look for some key themes in this. I think just everyone knows, just mute if you're not speaking, especially so that Vero doesn't have background distractions as she's presenting. And then this is a very safe space. We respect the comments from everyone, what they'd like to share. And if you'd like to share with me, I am the moderator. My name is Bernadette Gillick, and I am the moderator. So if you'd like to share privately with me something that I can then help you either to put into words, or if you just like to have a comment to me, I'm more than happy to receive that comment as well. And so I am asking if people could, if you are willing, to keep your video on so that we can see each other and be able to interact. I understand if that might change your bandwidth and it isn't accessible to you, but we're asking if people would, that would be great. And so without further ado, I am going to introduce my esteemed colleague, Veronica Skiridi, and let her explain her role in our task force and beyond in terms of her background and her exceptional work. So thank you so much, Vero, for being here this evening, morning, middle of the night, for all of these wonderful people on this call. And I'll hand it on over to you.
Perfect. So I'm going to share my screen. Let's see. Let's see if you can see that. Okay. I think, the first slide is on, can you see that?
Looks perfect. Looks perfect.
Awesome. Okay, so welcome. I am Veronica Skiridi. Thank you for the introduction and the opportunity to join this session. I know that you were on a marathon of sessions around the world, and we're ending. And this is 4 p.m. in Canada, in the West Coast, and so I'm really excited about this initiative. I am a developmental pediatrician, and I am fully dedicated to research. In the last couple of years, I've been doing international projects and promoting functioning and positive language in healthcare, and this is the perfect initiative because it's a collaboration, and it's like, I think for me is a great motivation, so it's a great opportunity as well. So I am representing the Aacpdm in the task force, and I'm leading the survey subgroup. So I want to tell you about what we are doing, and this is a conversation. So please stop us and share your ideas, and hopefully you have suggestions, and we'll learn from each other. So the title is Global COVID-19 Childhood Disability Data Coordination. That's the project that we have launched. And it's a collaborative initiative of the International Alliance of Academies of Childhood Disabilities. Just to put this in context about COVID-19, the COVID-19 continues to develop with rapid spread across the globe, and there are 35 million, more than 35 million confirmed cases around the world, and this is based on today's WHO situation report, October 6th, World CP Day, and the Americas is now the epicenter. There are almost 90% of the world's students have been affected by nationwide school closures, then more than 1.5 billion children and youth, and that was a report shared by WHO on April the 6th, 6 months ago, but we know that the situation is continuing, and so we would like to hear from you as well, what's the situation in your countries, in your regions. And the pandemic has and will have an economic impact, and We know that this was based on a UNESCO report and published in Lancet in April 2020, that it is expected that will increase social inequity with permanent consequence on the health, well-being, and learning of children with or without disabilities. So, we have a huge task ahead of us, and I think it's important that the world gets together to try to solve these things. What about cerebral palsy? Today is World CP Day, and we know that 1 in 300 to 1 in 500, depending on your region, has cerebral palsy worldwide, and it is estimated that almost 17 million people live with cerebral palsy. Trying to use an abilities-oriented approach, I want to share some facts about CP, but on a positive side. So 2 in 3 kids are able to walk, 3 in 4 are able to talk, 9 in 10 has a mild vision impairment, 1 in 4 has no pain, but all of them, kids, all enjoy playing. There are more facts that we can share, but hopefully we can use this kind of vocabulary and this kind of approach. And children with CP must receive appropriate environmental modifications and support to achieve their functional potential, important to be considered during health emergencies like the one that we are living due to COVID-19. So this takes us to this big task force and international collaboration that we are doing. We know that COVID-19 continues to cause major disruptions in service provision, participation, and overall well-being of children and young adults with disabilities, including CP, and their families around the globe. As such, the Alliance has created a COVID-19 task force with the main goal of learning and understanding the impact of COVID-19. In summary, the big group that represent all the academies of childhood disability are organized in 3 different subgroups: the surveys subgroup, the resources, and listening and sharing. I'm leading the surveys subgroup with a great group of people from around the world. We're representing all the continents in this subgroup. And we are working on the global COVID-19 childhood disability data coordination. And basically, we're looking for and collecting surveys from around the world, ongoing and completed surveys that represent or describe the impact of COVID-19 in people with disabilities. And the resources subgroup is doing a great job identifying resources grouped in these 3 themes: help for families, remote support, that is telehealth, and successful ideas. And then the 3rd group organized this global event that has been a big success. And we want to share with you, I think that's the main thing, listening and sharing and learning from each other. So we have produced flash news every month, trying to describe the progress of these projects. It's a big project, but we wanted to answer this key question: what is the short, medium, and long-term global impact of the COVID-19 crisis on physical and mental health, participation, education, service provision, and financial status of children and adults with disabilities and their families around the world? So far, we got 36 surveys, and there are more coming. We know that the COVID has moved in different phases, and so people organized their resources and invested some efforts on running surveys to learn from their situation and the experiences of people living with disabilities in their regions. So it's a rich information, and that's something that is important to share. There are 18 surveys that are actively seeking participants, so hopefully you can go and check the website and participate. And 17 surveys were developed in collaboration with people with disabilities, which shows that less than 50% of those surveys, people with disabilities help develop the content of the questionnaires. And I think this is important to show that still we need to do a better job on that area. some of the themes that were frequently covered by the completed surveys that we are analyzing is the impact of COVID-19 on mental health of children and their families, satisfaction and experiences delivering remote support, and we're learning a lot about that, impact of social isolation on teenagers with disabilities, and impact of remote learning on children with disabilities. These are some of the themes that I want to highlight, but we're learning as the surveys are completed. Few surveys target a global audience, and I think we need to work on that as well. So some of the surveys just target specific regions, or like within a country, a specific province. So, you know, like we can learn from each other if we have a better target population, like the global audience. So my invitation for all of you is to share your experiences during this session, and on checking on our website and share your surveys and resources with the international community. And I think this is my last one. So happy World CP Day, and thank you for your attention. And I'm open to discuss with you your experiences. I think I'm gonna stop sharing.
Thank you very much, Vero. So anyone have anything to start off with in terms of discussion? Incredible amount of background, wonderful work that is coming, and looking forward to all that is to come in terms of our understanding of what has happened with the impact in these surveys across the world. Vero has obviously an extensive amount of background with this, and also really her finger on the world pulse of what people are asking and the inquiries that are happening. So let's open this up for discussion, and feel free to unmute unless there's something in your background, if you'd like to just be part of the open conversation. There's a perfect number for us to be able to do that.
Awesome.
And Alicia is just right now back and forth between two different meetings, so just to let you all know.
Okay.
Anyway, I have a question to kick us off, if that's okay. So, Vero, is there anything from what you're seeing with these surveys that is surprising you, knowing that you have a very vast knowledge of what is happening throughout internationally, the communities with cerebral palsy? Is there any trend that you're seeing that's surprising you, or that is it is something new that we wouldn't have known about?
Yeah, so most of them, you know, like I think the motivation was to identify needs, like, you know, most of the surveys, that was, you know, one of the main thing. And I think one, like coming from different regions, like, you know, I think a common theme was lack of information, like timely information about, you know, what to do and how to proceed. And I think that's something that is easily modifiable if you want. And so something that we need to get, like, be ready and help. And I think that's something that we can do and collaborate with. This is not over, so it's still, you know, like affecting different regions, and another wave is coming in different regions as well. So, you know, that's something that we should do. I think that's the idea, to have this monthly report to identify gaps and needs, and try to you know, like try to proceed and do something about that. And you know, there's an action that is needed, and I think that's something that we can collaborate on.
Great, thank you for that. Another question, or anything that anyone wants to share from their perspective, from your different edge of the world?
One thing I was just going to say is I really thought your the way you're doing a monthly update, a quick sort of all-in-one, very quick, sharp message is really good communication. It works really well.
Sure. And I have a question for all of you. If you are aware of surveys, and not only, I know that many of you participated, you know, completing surveys and answering surveys, are you aware of the results? Like, you know.
I'm going to defer this to Ellen Suter. So I think that she could just, there are a couple people on this call, Ellen, that weren't familiar with what you just presented, but it really answers what Vero just asked, if you don't mind speaking to that.
Yeah, absolutely. So in the earlier session today, I shared the results of our survey, which was primarily in the Midwestern United States. And we do have results of that. We're still working on publishing them, but in that presentation I did share some of them. And we were primarily looking at both the impact on access to rehabilitation therapies for children with cerebral palsy, and then also impacts on physical and mental well-being, both for children and for their caregivers. And it was all a caregiver reported survey.
Yeah. That's great. Thank you.
And so I guess perhaps unexpectedly, we found that there was quite a significant impact on access to rehabilitation therapies. Many children didn't have access either via remote or in-person methods. So we did our survey between May and July. And then that had subsequent impact on child physical and mental health, and also caregiver perceived burden.
Yeah, I think, the task for us is, what's the next step after running a survey. I think it's a lot of work, to run a survey and then analyze and summarize your results. But I think we're in a stage that we need to really act quickly and share the results so others, will learn from that experience. I think that the big motivation behind this project is just trying to learn. And one thing that we're doing is mapping the content of these key findings or results of the surveys to two frameworks, the Convention on the Right of the Child and the ICF. And we're learning that there are some of the articles of the convention that are well represented, like access to services, access to education. But there's one article of the convention that talk about information or access to information, and that was not well represented. So, it's something that we're learning, and it's the right, to get information at the right time and to protect yourself. So I think, that's important. And the idea is to share that and plan actions based on that knowledge.
And it's who we share that with as well, isn't it? It's not just our wider kind of childhood disability community, but politicians, the decision makers within society. That's sort of, it's a huge opportunity, isn't it, to influence a lot wider than our community, and very powerful with the amount of data that you'll have collated there. Yeah, it seems like we need to do something really powerful with it.
Great. Dawn, did you have a comment as well?
Am I muted? Oh,
no, you're good.
I was just thinking really that one of the difficulties with, that exchange and access of information is that it seems to be a constant change. And, just in the UK alone, between England, Wales and Scotland, the information that we get is different. The information that we give out is different. And that's just in the UK, and it is constantly changing, and it's changing so quickly, from week to week or sometimes day to day. I was just thinking that's one of the difficulties about sharing information.
So you're referring about restrictions, or how the public health information?
Yeah, yes, all of that. We get the information from the government, and then that then reflects the information that we can then give on as well.
Sure.
As well as we make the changes to the system or the support that we give depending on what the advice is that we have, and that always has to change.
Sure.
Lisa, can I ask you, in Israel, what the framework is there? Whatever you'd care to share.
No, that's fine. Well, I'm an occupational therapist. That's my line of work. And I work in two different environments. One is a special education school for cerebral palsy, mainly children that move from the age of 6 to 21. And another environment that I work in is a part of the Ministry of Health. Now, I don't know, that's why I didn't want to be, I try to be accurate when I give out, you know, when I share my knowledge.
Sure,
and
no, understood.
And I have to be very specific about sharing what I know together with you, because I wouldn't want it to be not accurate.
No, absolutely.
We have had a few surveys being done in the country. And I did want to ask you, Veronica, if you know of any surveys from Israel, that meaning if people were in touch and sent in that material, because if not, I can at least see to it that it will be forwarded towards, you know, the globalization of what we were talking about earlier. But specifically in Israel, one of the parts that I am in contact with, we have throughout the country around, I think it's close to 130 or 140 special daycare centers for babies, young children. It begins at the age of 6 months up till the age of 3 years of age. And in that daycare center, there are also special education teachers teaching there, kindergarten teachers, and together with a variety of occupations, like an occupational therapist, a physiotherapist, a speech pathologist. They have social workers, psychologists. So it's a very large variety that allows the parents to go back to their everyday work and for the children to have a one-stop treatment area. That's why that daycare is. And the survey, one of the surveys that we had through in the country was just after we went into our first lockdown, which was around March. And now, I don't know if you know, but we're in our kind of a second lockdown in Israel nowadays.
Okay.
The special education facilities are the last to be locked down due to well, I'm trying to be very accurate, as I told you, with my words,
Sure.
but I know that there was quite a lot of pressure from the parents asking that those facilities would remain open as possible in order to allow mainly for the children to have their day-to-day routine that they're used to having. That was very, very important. I know that the government had a lot of pressure on that matter.
Were those advocacy groups, Lisa, or were they individuals, or how did they express their voices?
Both. No, nowadays everything goes through Facebook and this, that, and the other. But there were also organized, yes, but there were also organized groups, mainly not so much on the Cerebral Palsy Day, but mainly the ASD parents.
Okay.
With children on the autistic spectrum. So that they had a very large advocacy, and that's why most of the facilities are working. Some of them are working, as we know, with telecommunication with the families, but most of them are on regular basic contact. Okay,
so Kirsty is responding to what you are saying as well, Lisa, saying we are facing the same situation in Melbourne, Australia. Special schools were the last to shut down and the first to reopen.
Exactly.
So it sounds like that's what's happening from what your perspective is as well.
Okay. Absolutely. Now, just going back to the survey, as I don't want to give out not accurate details, but the survey was sent out for, if I was talking earlier about the very young toddlers, that daycare centers. So it was sent out to the people who organize those centers. And on the other hand, it was also sent out to parents. So we already have, it wasn't my contact first job, so I don't have the accurate numbers, but
Sure.
I will see to it if Veronica, if it needs to go to you or to anyone else organizing the whole data around the world. I'm sure it'll be important for you also to read and to understand what happened, what were their thoughts. It was especially about when we were in the lockdown period, how much the families found it easier or more difficult to receive if their child needed special medications, if there was also through the telemedicine, if they had all the equipment that was needed, what was the most useful part of it for the families, what was lacking for them, new ideas that they had to share with us. So that was the main issues. You know, it was an organized survey. They just needed to click, and they had a few spaces of open questions.
Nice.
That's
Nice.
Just one comment. We didn't get any surveys from Israel, so it will be like great if we can get information about that survey. And the, you know, like the steps are like, if you go to the task force page, we have a section on the surveys, and it's just a short form to describe, you know, the population and exactly the details that you were giving, and just tell us if you have access to a final report or like key findings of that survey. It will be great. And we welcome all the languages, and so it'll be great to have that information. One of the things, like just to like describe, it was like we have learned from other surveys that it was meant to capture information from professionals or proxy, but there were like no direct surveys directed to kids with disability, and there was only one coming from China, and I saw Warren here. And
yes. And I think she had her hand up too, Vero. I think she wanted to share something with you.
Okay, oh, that would be great. So it's so great to see, you know, like surveys coming from all over the world, and we celebrate that one that was, you know, like sharing information directly from kids.
Yes. So Gelong, do you have anything that you would like to offer or share?
Yes, thank you. And sorry, Veronica, at last we lost contact. I cannot send you emails. Sorry, we must figure out what's happening. I really like this idea, especially Veronica's idea about the survey of the surveys, right? It's very interesting. We share information and we learn from each other. And also, I really like this idea of the global conference for 24 hours. So everybody must be tired, but I'm really excited about it. And we have done just like, I sent a bit of information to Vera, and I have a survey of children during the lockdown period. And I sent the questionnaire at the end of April, and I got a response of over 500. And the children, most interesting is the children who are, over half of them enjoy the lockdown time. It's very interesting. And
now,
when I look at,
do they say why?
Yeah, yes, I just analyzed why they said. So when I look at their answers, and I found out people say enjoy, and most of them are engaged with the family chores. So they really like they cooking with the mother and play with the parents and play with the peers. So this is very good, and also the inspiration for us when we do the therapy, so how can we make children engaged and active, motivated? And interestingly, we also have another survey from Shanxi, and last night she shared this, and she did the teletherapy. Let's say they gave the parents, the instructions at home, and the parents feedback with their video, so showed video clip what they're happening at home, and also the result is consistent with my results, and the children at home, I enjoy working with parents, cooking and the things like happening at home. So this is very interesting. Also, we learned that when we provide therapy, we should be more like children engage with daily activities, not therapy. It's just something they enjoy, and they like when they make dumplings, they use their hands and they can stand, listen stories and telling stories, this kind of thing. It's very interesting. And another when I listen to Lisa, when you say, and also the Australia thing, they you shut down the special school last and open at first. This is opposite in China. And we always think the children with disability, they are vulnerable, and we try to protect them. So we shut down the special school first and open until I think until end of September. So this is really for the parents are very depressed.
Yes.
They have lots of complaints. They say, everybody goes to school, but not my children. So I don't know why is this in Israel? Why you shut down last, or
So it seems to be the opposite of
yeah,
what Lisa
China
is saying
opposite.
in Israel.
Yeah,
is happening in China.
Yeah.
In Israel, apparently, the shutdown, the last to go into shutdown were the special education schools, and the first to open.
That's happening in your country, but mine is opposite.
It's the opposite.
I'm interested in curious about why it's there in your country, because in China we try to protect them. There's a government say like that.
Protect them from COVID, Yaron, is that right?
Yeah.
So why that in Israel?
My personal opinion is very similar to your own opinion, or to the Japanese community opinion, that as I tried to explain earlier, first of all, we had a lot of pressure from the parents, and also it was easier. The first shutdown that we had, the first lockdown that we had, that was about 2 or 3 weeks. The whole country was in a lockdown, and that was the easier time for the parents to engage in being with the children at home, also the special education children. But later on, as the Israeli world came back, and the families, the parents started engaging back at their work, it was much more difficult for them to keep the children at home when both the parents have to go to work. And as in COVID-19, with the grandparents not being able to assist the young children, that was a major issue in Israel, with the government intervening and helping as much as possible the children to be first to go back to their school or the kindergartens, to allow the parents to go back to work. So it's kind of a mixture, I think, between keeping everybody healthy and safe and keeping the economy running. Because in Israel, a newborn child, the mother or one of the parents will only have between 12 to 14 weeks of free time at home, and then it's supposed to, the family is supposed to get organized and the parents can go back to work. I know in certain places in Europe and maybe other places in the world, sometimes the mother can stay, or one of the parents can stay at home up to even 3 years with a toddler. That's not something happening in Israel. So I think
Israel
that
right now.
It has nothing to do with the COVID-19. That's the way the economy works in Israel. Then the COVID-19 just came on top of it.
Is on top of it. It seems, Vero, do you have a comment or a response to what Lisa and Grong are saying?
Yeah, so there were like many surveys describing the burden of the caregivers and the parents. And so I think that's one of the things that try, you know, like that was one of the actions that in some regions were taking, is try to keep, you know, the special education or the sort of daycare rehab centers open for the kids. In terms of protecting the kids, like in China, like, you know, that belief that you keep the kids at home. My question to Warren, if the kids have options for remote education or remote therapies, because, you know, that's something that we need to take into account if they were you know, if there was lack of education during that prolonged time. And so that's lessons learned, like, you know, from different regions. And you know, it's important that if we learn this, we make recommendations, you know, because this is not going to be the first pandemic or like the first.
Right. We hate to say it, but it's true. So can I reframe that question, see if I have this correct, Vero? So Garong, what are the remote possibilities for interventions for access to rehabilitation in China?
Thank you. Actually, the service didn't disrupt for a long time. Most of the centers start working at early February. So we have quarantine time at 24th January, and we gave the service at, I think the 8th. It's just right after the Spring Festival, so early February. So during this time, especially our pediatric committee, all the professionals organized a lot of the conference like this. So ask professionals how to fight this COVID-19 with children with disabilities. And so everybody must do something. So all the centers were asked to give the, because it's easy with this smartphone, and they just gave the instruction and how you hold your child at home, when you feed your child, what should be the right position, the things like that.
Sure.
And yeah, and also for the special education school, they also have the like this kind of teaching on this video, on this with computer. So everybody has a computer. I saw some of the people in the remote area, they have not easy access to the internet, and they go to the top of the mountain and receive the things better, and they use their iPad. So
or they use their cell phone or whatever it might be. Okay.
Yeah, and also there are stories like if there are two children and they have different classes and they have fight with the phone and lots of arguments like that. But the result is, one of the results is some of the children have the eyesight problems now because over a couple of months they look at the phone and they must do their homework with their phone. And but another thing that they have, that the better skill of using smartphone.
I think I'm with them on the eyesight thing, having spent the last 6 months with just one focal length. I think it affects all of us.
Yeah.
I think it does. That's a good point.
Yeah.
I mean, one of the things I think that changes over time, isn't it, is that balance of risk, because we shut down all the schools to start with, pretty much except for some of the special schools that stayed open because of the care burden. But this time now we're sort of on phase 2 lockdown, and we've kept all the schools open. So I think the risk changes, doesn't it? When it's right at the beginning, then the risk of not having intervention and not having the support is much less when you think it might be for the next 3 weeks. And then now that it's been 6 months and it's, you know, we're looking at this now in a different way, aren't we, as a long-term something that's going to be living within our community for a while till we get a vaccine. Then the balance between not getting education, not getting interventions, you know, some of the children that get put in specialist equipment that parents can't manage that on their own. The balance of not having those things changes versus the risk of getting COVID. That, you know, it's all a risk assessment, isn't it, which changes as time goes on.
Yes.
And just from local conversations, this wasn't a survey or anything, but around here, certainly what they were saying was that even though the schools were open, the parents were actually afraid to send the kids back. And they were asking the doctors, well, should we send them back? Can we send them back? But the doctors didn't know. So, you know, they just didn't know. And in the end, so we had a little, a bit of a local listening and sharing session. And by the time we got around to that session, when we asked the question of the doctors, well, what happened in the end with the parents? And they said, well, all the parents, they sort of got a group together and they made their own decisions. They decided when to send them back. So
this combines both what Vero said about information sharing, which is really important, and also what Lisa was saying about how the parents really are coming together as a powerful voice and making those decisions in order to move the dial forward, right? With information. I will say this in a very light tone. Listening, Lisa, to you and Garong to you, I'm in the United States. I'm American from the United States, and our message is very different as well, Dawn, all the way from the Commander-in-Chief, our president, all the way to our local communities and the information that we've been given. So it is, for the families with whom we work, is also a challenge because there is not one consistent piece of information. So Vero, I really respect what it is that you're saying with getting information to people, parents, caregivers, and children, so that they can understand what is the edge of what we know and what we're doing as a community, which I'm hearing as a theme here throughout what we're saying. Any other thoughts? Anything else to share along this line, or a new train of thought? I know we have a few people who just joined us: Kirsty, Reem, Sean, and Anne. It's such a good thing that you're here. We understand that some of you are in open offices right now, and so you don't want to turn on your microphone, but we do welcome any chats that you'd like to share with anybody. And we certainly welcome your video to be on if you're willing, just so we can be apart together, as the theme of the conference is. So please feel welcome that way. Vero, please.
Yes, I have one more comment that I think, like we have to have an optimistic, point of view, and there are lessons learned, like you are from different countries and sharing nice stories. One of you mentioned, like the importance of focusing on routines and how, building the intervention or the therapies based on routines and engaging kids on, like you can build on the cooking session or the things that the kids are interested in. And I think, like we're gonna learn about, like how to deliver services to remote areas or to, busy areas, and And from this experience, and we were forced to do this, but I think like there's good things that are coming out of this, and I think that will be one that is the routine-based interventions, and is like trying to increase the functional abilities, or like building our interventions into the day-to-day of the kids.
I really appreciate, Vero, in your slides that you presented in the beginning, to look at, there can be two ways, there can be 20 ways, but there can be two ways to look at things. And I really appreciate how you framed that in terms of some children will not have pain, and some people, all children want to play. And so it's such a way to move through this pandemic into a train of thought, how we as healthcare providers and researchers and clinicians also are getting through and learning more through this pandemic to come out on the other side. I really like that framework, and I appreciate how you put that together. It reminds me of that, right? Garong's thumbs up, and Ellen, you have a comment as well.
Yeah, I was just going to touch on those kind of positive learning experiences that we can have from this. And I talked about this a little bit in the earlier session too, but one of the themes that was consistently coming up in our caregiver responses was just some of the positive aspects that they've been experiencing, or some of the ways that they've been noticing support, or even ideas that they have and that they wish they, ideas that they have for support in the future. I remember one person had quite a long comment about, a really great idea for developing a video library of different, basic exercises that parents could do with their children. Or someone else talked about a virtual exercise group that their son was participating in, or different ways that maybe in the future, some medical appointments could be moved to telehealth while others could remain in person. And just, I think that that caregivers and people with disabilities and healthcare providers all do have such a wealth of knowledge of what's really worked during this pandemic and what can stay even after it's over.
Really good points. You have this firsthand knowledge of your survey of learning these different things and sharing. Thank you those points. Kirsty also just said has a question. So in the countries that have had school shutdowns, was there still an option for students to attend? So we had strict criteria you had to satisfy. For example, caregivers had to be essential workers, or the child is at risk, vulnerable if they stay at home, but it was still possible for the students to come to school. So I think this is, China and Israel, in the countries that have had school shutdowns, was there an option for students to attend? No, Garong, you're saying no. Do you mind taking your microphone off and explaining from your country's perspective?
Actually, not only schools, anyone cannot go out of your door. So everything delivered to your doorway.
Your food, anything you needed.
Yeah. For the first, I think until the end of April.
So how many weeks was that, Garong?
4 months.
So for 4 months, the essential workers were delivering food and necessary items, but you could not leave your house.
Yeah. So if you want to go out, it's very urgent. You have to have application, like you have the certificate you gave through the door, and only if I do want to have let's say a vegetable you didn't deliver to me, and I have to go to select myself, and you only have one people from one family. It's very strict. Very strict. Yeah.
So in that option, students couldn't attend at all because no one was leaving their home. Lisa, how does that compare to you in Israel?
The more I hear, the more I understand how flexible we've been. But it takes one to know one. But living in a country, I first thought that we had a very strict lockdown. But now that I can hear Grong, I understand that it was quite light. when the schools and the special education facilities were shut down, it was for maximum, if I remember correctly, for 3 weeks. It was less than a month.
Okay.
Yes, that was between the 15th of March, just towards the middle of April. And then the special education schools returned fully. It was allowed for the students, for the children to come to school, but as Veronica, I think you mentioned, not all parents chose to do that. But the facilities were open. I mean, the workers were supposed to be at work, unless the worker was above a certain age or had background illnesses that didn't allow that specific person to come to work. But otherwise, the special education schools, the kindergartens, the special education facilities were all open for service. We did have, well, in my words, we had strict notions about how to get around, because when I hear what Gerong is saying, so it's quite different than the way that you managed with that at that period of time, because it was, well, we went by meters. You know, if you have a
Sure.
center, and it depends on how many rooms you have there and how large the room is. So if you'll have 2 physiotherapists working in a certain area, or only 1 physiotherapist. If we take shifts, if we had like capsules, yes, certain people working in a certain environment, but the same people worked on the same days. So in that way, we managed to make it more specific, that not so many people meet with too many people, other individuals.
Sure.
So that was part of the way to manage with it. One last thing that I would like to talk about is about the telehealth. We used, especially with the elder children, we used, I think most of the countries also use that, like we're doing right now with Zoom or with Teams, which is more, it's more useful, well, in Israel at least, it's more useful for the children in the special education schools, because it's more ethical to use. Well, I don't know if the ethics is the right word,
sure.
but it keeps, it's more, it's not like Facebook when, or any picture, or if we're having a personal talk, everything will go out into the media. Exactly.
Yeah.
So those were mainly what we used. I have a last note to talk, because Gerong spoke about if you live outskirts of a main city and you have a difficulty maybe with Wi-Fi or things like that, so you can go on a higher area. For us, the main issues were differences in culture, and we have very religious people who will not be using telemedicine or telecommunication or even a smartphone. So that's still, till today, that is still one of the things that we really need to think through, to see how we can give those families with the children remaining at home, to give them a good, if it's educational or therapy treatment in different ways. And usually, so that those are our issues nowadays.
I'm going to take that. That's so interesting. We're really getting this international viewpoint from everyone speaking here. And just the contrast, comparing these two. Reem, did you have anything that you wanted to add? It's nice to see you. Welcome. That's fine. I do have a comment from also from Sean here. It depended on what alert level we were at in Australia and New Zealand. At the higher alert levels, there was no physical attendance at all. When the alert levels were relaxed, the schools allowed it to be up to the parents to keep the child home if they could. And from what I understand, this put some people in a difficult situation in terms of making the right choice. Once the alert levels were dropped, then everyone had been encouraged, i.e. told, to send back to school. Another comment, another viewpoint. Kirsty also said, very insightful. Thank you, Lisa and Garong, for what you are sharing there as well. Reem, I'm sorry if I cut you off.
Yeah, no worries. So I am from Saudi Arabia, and it's interesting to hear everyone what they're doing. So here it's a bit similar. The difference is like we had a period of lockdown. Sorry if you hear me. Yeah. So
Yes.
where the all the therapy was for a bit of time was discontinued. Then it's telehealth, and but school it's still remote learning, online, everything. And yeah, but it's more telehealth. I think it's stronger for the medical services other than rehabilitation.
Okay.
So it's rehabilitation is emerging more, but now we have physical contacts for with precautions and everything. But yeah, so clinic is back to work.
Okay. Okay.
2 months ago or something.
2 months ago. So how long was your initial frame of having reduced or no services?
So for me now, I'm doing my PhD, so I'm more focusing on research, not doing actual, because not doing actual physiotherapy services for this time.
Sure.
I'm finishing my PhD. Yeah, but from my co-workers and who are working at the hospital, it's going slowly. I think parents was really interested to go back finally to receiving therapy.
So the parents were very interested in going back, trying to go back. Okay, again with the variation. And good luck to you in finishing your PhD. Congratulations on your efforts. So I'm so grateful for everything that everyone is sharing. We have 3 minutes left of our session. And what we will do is also we'll make sure that we're saving the chats that Denny is working behind the scenes here as we're speaking with recording and doing this. But being able to assimilate this information is a big part of what our COVID task force is doing, so that this will be information that we are trying to bring together and then share formally with all of our efforts for what is happening right now. And then, as Vero had alluded to, what will inevitably happen, whether it's a pandemic, whether it's economic, whether it's location, environment, those type of things, the challenges that we face. So any closing comments, Vero, in a minute or two, if you have them?
Yeah, sure. In the first one, a comment that was raised is having cultural sensitive recommendations or interventions, and I think that's such an interesting thing. We need to be very sensitive and have options. It's not just one way that will work for everybody. So that's one thing, and it's I think that's great that we can work as next steps about this. And the second one is the message is that during lockdown or without lockdown, the kids are they are still growing and developing, and we should be able to promote and celebrate childhood with or without disabilities. So one of the things that we should talk about is play, and ensure that they are playing inside, and options that they should keep enjoying. I think so that was one thing that we didn't talk about, but it's keep them moving and playing and connected with family. They couldn't see grandparents, but they can have a telefamily, or we need to think about those. And
that's a very good point. Very good point. As we all say, play is their work, play is their job. That's what they're doing. And as I say, also when I'm teaching, children with disabilities still grow and develop. You have to remember that. It sounds very simple, but it is so true. And we all know that, and we are advocates for that. So I cannot thank everyone enough for being on this call. The title of our conference is Apart Together, but we're together, and here we are. We're stronger together. We learn from each other. I'm going to be thinking about this for weeks to come, obviously, but this conversation is so vivid and valuable in terms of what was just shared. And I very much respect the energies of everyone on this call. From 3 a.m. in the morning, which is now for Lisa, to 1 a.m. in the morning for Dawn and Jenny. I don't know what time it is for everyone on the call, but I really would like to say thank you from the perspective of the International Alliance of the Academies of Childhood Disability, and to know that we are together in all of this. So please feel free to reach out to all of us. We have our information on our website, just as Vero alluded to, for the surveys, as well as our information for ourselves. So if you feel as though there's a follow-up comment, I am happy to incorporate that. If someone would like to write me, my information is on the website, so you can reach out. Here's our finale, and I agree with you, Dawn. Thank you all, great finale. And it is because of everyone on this call that it is exactly that. So thank you very much, everyone, for attending, and take good care out there. We are in this together. So goodbye.
Thank you very much. Thank you.
Hi, Vera. I must talk to you, Vera. Are you?
So
oh, you still have a meeting? Okay.
No, we don't have a meeting. And if Gurung, if Vero has time, I'm more than welcome to continue. It's just that right now Jenny is recording. So I'm wondering, Jenny, do you want to stop the recording so they can discuss?
Yeah.
Actually.